For many people now left wondering just how contagious is this virus.
Dr. Mas Gomez joins us now with a closer look at the virus and what you need to know. So many questions, so many concerns here.
That's right, Mary and Chris. You know, Ebola is by no means the only deadly infectious agent that hospitals deal with on a routine basis. There are many. That's especially true for major medical centers that are likely to be the only ones which will deal with any suspected Ebola cases. Now, the first step is an isolation room to make sure any airborne germs are kept in the room. Next, there's protective clothing, including gowns, gloves, masks, goggles, and footgear. Putting on that protection is cumbersome, but not as key as how you take it off. That's when any infectious agent might be on the gear and on the healthcare worker. That's the healthcare worker has to be extremely careful not to contaminate themselves by coming in contact with the germs. But even then, there has to be a route of entry, an open cut or rubbing eyes, nose, or mouth after contamination. That's the only way the germ actually gets in to cause the infection.
So let's talk about the transmission here and how easily you can get the Ebola virus for people that are wondering how contagious is this thing.
Right, exactly. And that's really the good news here. The good news is that this is not a particularly contaminated, or rather infectious agent. It requires close contact with bodily fluids, blood, feces, vomit, the kinds of stuff that a nasty infected patient is going to spew forth or whatever. And then again, you need that kind of close contact. And remember, there were 2 patients at Emory that were treated there in isolation rooms. No one got contaminated, no one got infected from there. So this is doable. It's hard to do, but this is doable.